Hi, my name is Naraja and I'm a Level 2 MOMAC nursing student. Today I'll be demonstrating how to prepare and administer an intramuscular injection and a subcutaneous injection. You want to begin by checking the accuracy and completeness of each MAR against the prescriber's original medication order. Check the patient's name and the medication name, dosage, and route and time of administration. Review pertinent information related to medication, including its action, purpose, side effects, and nursing implications. Determine whether the patient is allergic to any substances and the usual allergic reaction experienced. In this scenario, Mr. Mancini is allergic to codeine. Assess the patient's body build, muscle size, and weight. Perform hand hygiene and assemble the medication supplies. Use a needle that is appropriate gauge and length according to the route of medication and the patient's size and weight. For Mr. Mancini, he was prescribed heparin 5,000 units subcutaneously, which is 1 milliliter, and Haldol 1 milligram intramuscularly, which is 0.5 milliliters. You want to begin by removing the cap covering at the top of the unused vial to expose the sterile rubber seal. Firmly and briskly wipe the surface of the rubber seal with an alcohol swab and allow it to dry. Pick up the syringe and remove the needle cap. Pull back on the plunger to draw up the amount of air into the syringe equivalent to the volume of medication to be aspirated into the vial. For the subcutaneous injection, it will be 1 milliliter of air that will be injecting into the vial. With the vial on a flat surface, insert the tip of the needle. Ensure the bevel tip enters first, through the center of the rubber seal. Apply pressure to the tip of the needle during insertion. Inject air into the vial's airspace, holding onto the plunger. Invert the vial while keeping a firm hold of the syringe and plunger. Hold the vial between the thumb and middle finger of your non-dominant hand. Grasp the end of the syringe barrel and plunger with the thumb and forefinger of your dominant hand to counteract pressure in the vial. Keep the tip of the needle below the fluid. Allow air pressure from the vial to fill the syringe gradually with medication. If necessary, pull back slightly on the plunger to obtain the correct amount of solution. Remove the needle from the vial by pulling back on the barrel of the syringe. Hold the syringe at eye level at a 90-degree angle to ensure the correct volume has been obtained and no air bubbles are present. Remove any remaining air by tapping the barrel to dislodge the air bubbles. Draw back slightly on the plunger, then push the plunger upward to eject the air. Do not eject the fluid. Recheck the volume of medication. Dispose of all swell supplies and place used vials and used needles in a puncture-proof and leak-proof container. Clean medication work area and perform hand hygiene. Create a removable label that shows the patient's name, the name of the drug, and the dosage. Apply the label to the removable needle cap. You want to repeat steps for the IM injection. Here's my completed IM injection. You want to then bring the medication to the patient at the right time and perform hand hygiene. Close the room curtains or door. Identify the patient by using at least 2 patient identifiers. Compare the patient's name and one other identifier on the MAR against information on the patient's identification bracelet. Ask the patient to state his or her name if possible for a third identifier. Compare the label of the medication with the MAR one more time at the patient's bedside. Describe the steps of the procedure and inform the patient that the injection will cause a slight burning or stinging sensation. Perform hand hygiene and put on disposable gloves. Select appropriate injection site. Inspect the skin surface over the injection site for bruises, inflammation, and edema. For a subcutaneous injection, palpate the injection site for masses or tenderness. Avoid these areas. Ensure the needle is the correct size by grasping a skin fold at the injection site with your thumb and forefinger. Measure the fold from top to bottom. The needle should be half the length of the skin fold. The needle should be 1/2 the distance across the fold to give it a 90-degree angle. For an intramuscular injection, note the integrity and size of muscle and palpate for tenderness or hardness. Avoid these areas. If injections are given frequently, rotate the injection sites. Use the ventral gluteal site if possible. Deltoid muscle, vastus lateralis, and rectus femoris are other locations an intramuscular injection can be injected into. I will then assist Mr. Mancini to a comfortable position. For a subcutaneous injection, have the patient relax the arm, leg, or abdomen depending on the site chosen for injection. For an intramuscular injection, position the patient depending on the site chosen. Have the patient sit, lie flat, lie on one side, or lie prone. Relocate the injection site by using anatomical landmarks. Clean the injection site with an antiseptic swab. Touch the swab to the center of the site and rotate it outward in a circular direction for about 5 centimeters. Remove the needle cap or sheath from the needle by pulling it straight off. Hold the syringe between the thumb and forefinger of your dominant hand. For a subcutaneous injection, hold the syringe as if you were holding a dart, palm down, or hold the syringe across the top of your fingertips. For an intramuscular injection, hold the syringe as if you were holding a dart, palm down. Administering a subcutaneous injection in Mr. Mancini. I will be doing it in the abdomen. You want to spread the skin tightly across the injection site or pinch the skin with your non-dominant hand. Inject the needle quickly and firmly at a 45 to 90-degree angle. Hold the skin fold until the needle has been withdrawn from the skin. Inject medication slowly. Withdraw the needle while applying an alcohol swab or gauze gently over the injection site. For the intramuscular injection, I'll be administering it in Mr. Mancini's deltoid muscle. You want to position your non-dominant hand at the proper anatomical landmarks and pull the skin down approximately 2.5 to 3.5 centimeters or laterally with the ulnar side of your hand to administer the injection in a Z track. Hold the position until the medication is injected. Use your dominant hand to insert the needle quickly at a 90-degree angle into the muscle. After the needle pierces the skin, grasp the lower end of the syringe barrel with your non-dominant hand to stabilize the syringe. Continue to hold the skin tightly with your non-dominant hand. Move your dominant hand to the end of the plunger. Do not move the syringe. Wait 10 seconds and then smoothly and steadily withdraw the needle and release the skin. Apply gentle pressure with dry gauze if desired. Do not massage the injection site. Put on a bandage if needed. Assist the patient to a comfortable position and discard the uncapped needle into a puncture-proof and leak-proof receptacle. Do not recap the needle. Remove disposable gloves and perform hand hygiene. Chart the medication dose, route of administration, site, time, and date of injection on the MAR immediately after giving medication as per agency policy. Report any undesirable effects from the medication to the prescriber, and record the patient's response to medication in the nurse's note, and report to prescriber if required.